Hello, my name is Valdez. I'm a counseling psychologist and I've been practicing in the mental health field in Trinidad and Tobago for the past 13 years. So today we're going to talk a little bit about depression. What is depression? It's a common feeling that everyone experiences at different times and which exists on a spectrum. It is also a major mood disorder. Both categories are characterized by sadness, dejection, lack of energy, hopelessness, as well as a lack of interest in daily activities. It can be chronic, meaning that it is long-term for at least 2 years, in which case it can be classified as persistent depressive disorder or dysthymia. It can be acute, which is a sudden onset of depression or a severe depressive event. It can also be mild or severe. There is no one cause of depression. It often develops as a result of a complex interaction between genetics and environment. So, how can these conditions be identified? Well, because depression exists within a range, it can look different on everyone. There are people who are pair happy or well-adjusted, and sometimes those people are going through severe depression. Sometimes their depression can end in suicide. For men, it is important to note that depression often presents as anger. It is important for us to bear this in mind, as depression may not always look the way we expect it to. Generally, however, it can look like feeling sad or having a depressed mood, anhedonia or loss of interest or pleasure in activities once enjoyed, changes in appetite, weight loss or weight gain unrelated to dieting, difficulty sleeping or even sleeping too much, loss of energy or increased fatigue, feeling worthless or guilty, trouble thinking, concentrating, or making decisions, suicidal ideation, which is thoughts of death or suicide, increase in purposeless activity, such as pacing, wringing of hands, inability to sit still, or even slowed movements or speech. It must be severe enough, however, to be observed by others. The sense that you will always feel like this and that things will never change, unexplained pain with no obvious physiological cause, such as headaches or muscle pain or even a stomachache. These symptoms must last at least 2 weeks and must represent a change in previous level of functioning for a diagnosis of depression to be made. Some medical conditions, such as a brain tumor, thyroid problems, or even vitamin deficiencies, can mimic symptoms of depression. So it is important to rule out general medical causes when faced with what appears to be symptoms of depression. So what should somebody do if they encounter or live with a person experiencing depression, especially if they're not a mental health practitioner? Well, it's important to recognize that oftentimes people experiencing depression may not be ready, willing, or able to accept what they are experiencing and confront it accordingly. As a result, you reaching out, as opposed to waiting for them to reach out, can be helpful. Check in regularly so they don't feel alone. Be present, as oftentimes people with depression tend to isolate socially. Compassion, grace, and understanding are key in offering support. Perhaps a tone of suggestion, as opposed to one of harsh instruction, may better serve the creation of a supportive space. Also, a willingness to go at the pace of the depressed person goes a long way in encouraging them to get help or to seek therapy. Assist them in finding the necessary resources, such as therapy or even a suicide hotline. Remember, no matter how well-meaning we are, the decision to access mental health support still must come from the person. Although there will be exceptions, generally the person has to be willing to get help for them to get help. If someone doesn't want to or isn't ready for help, you have to try balancing respecting their boundaries and looking out for their well-being. Thank you.